So, welcome to NUR203 and Professor Bogart. I know last week that you did had Professor Luminoso. I know she went over all of the rules, the regulations, what is required. The one thing I want to tell you about me, if you let me know what's going on before things are due, I can help you. And all I want from you is communication. I prefer questions than not asking at all. I don't think questions are silly or stupid, because if you don't know those answers, it is not a silly question for you. And I am sure somebody else in this class probably has the same question. So at no time do you feel like you cannot interrupt me, okay? If I'm going on in a lecture and I'm talking something and you're not getting it, please, please, please stop me, because maybe I can explain it in a different way. So the one thing I want to discuss is I can take, now this is the way I teach. I'm going to teach a PowerPoint. As I said, I make the PowerPoints, I make the Kahoots, I make all the exam reviews, I make all the quizzes. I'm the one that's responsible for all of that. So what I do with my classes, first of all, I'll teach a PowerPoint. I don't read a PowerPoint. I'm just going to give you the concepts, and I'm probably going to tell you a story of some child that I know of that had that something to make you understand it better. When we're done with that, we're going to do a Kahoots. Now, in between the Kahoots and the PowerPoint, if you need, we can do a quick break. If not, we can go quicker. I can get you out here early, usually, okay? There are some longer weeks, but I try to at least try to get you out early. What do you want to do? You want to go straight through, or do you all need a break in between? I don't
Straight through.
mind if you need to go to the bathroom. I don't mind if you
Straight
need to
through.
eat something.
Straight
I know you're
through.
going from community right to me. I know that you're under a lot of stress. Most of you work full time. I understand. So I can work with you if that's what you want. Try to get you out early, and that's what I'll do. Okay. Now, if you notice that I put week 2 information and gave you this week's information, I also put the announcement. I don't put 100 announcements. I don't do that, okay? So if you need something from me, week 2 information, when we're done with class, you're going to see week 2 recordings, and it's going to have the PowerPoint again. The Kahoots will be put there for you too, because those Kahoots and those PowerPoints are important. They have everything you need to know for your exams and your quizzes, okay? So I always put it in one place for you. Any questions about me and anything you need to know about this term? I don't want to go over everything because you've already heard it already. Okay, let's go on and let's get on with the PowerPoint and we'll go from there. So week 2 is an interesting week, a lot of information. Um, It's chapters 31 to 3, infants, toddlers, preschool. So it's ages 0 to up to age 6. So a bunch of stuff goes on, right? Think about infants. What happens? First year of life is the most dramatic of all life. You go from a baby born at 7 pounds. By 1 year old, they're 21 pounds. And they go from not even be able to hardly suck, swallow, and breathe at the same time. And then by 1 year, they're walking and talking. It's quite amazing the amount of changes that has to be done there. Now, what affects that child not gaining and being able to do all those things by 1 year? It's all about what they eat. Nutrition, nutrition, nutrition. If you don't put gas in the car, it doesn't go, right? You don't put food in that infant, their brains are not going to function and they're not going to grow. So weight is important. That's why when you see pediatrics, every visit, urgent care, ER, doctor's office, what do? Get a height, we get a weight. Why? Well, number one, it's measuring nutrition. Are they getting enough? Are they weighing enough? Are they weighing too much? And then as we go further into some of this disease entities and the different systems of the body, could be a thyroid problem, a hormone problem, could be your thyroid, could be your, pituitary glands, so very important, height and weight, we measure it, and that's going to tell a lot of stories with it. So a baby's born and they lose weight to 10% in their first, 2 weeks of life. And then all of a sudden they start gaining weight again. Why do they lose that weight at first? Well, they're floating around in a lot of water. They've got a lot of extracellular fluid, right? You can see a difference if you ever had a child. When they're born, then the nurse takes to do the assessment, right? Takes to the nursery for an hour or so, brings them back, and they look different because all of the swelling in the eyes, etc., because they've urinated a couple of times and gotten rid of a lot of that fluid. So, now they've lost weight, but they start gaining weight every single week. And by 2 weeks of age, they've gained up to their birth weight already. Now, interesting information. By 6 months, they should double their weight. So, born at 7 pounds, they should be 14 pounds. If they're not 14 pounds, let's say they're only 12. Well, something's wrong. They're not getting the gas they need. They're not getting the nutrition. So changes could be made as simple as maybe increasing the amount of food we're feeding them. Maybe it's even breast milk, putting fortifier or calories into that milk, or even formula, increasing the calories. I mean, normal formula is 20 calories per ounce. We can go up to 30 or more calories per ounce. So we can have the same volume, but make sure they're getting what they need to bulk up, right? For the first 6 months, they gain 1 inch of height every single month. So they need a lot of nutrition to keep up with that, okay? Now, when they're born, they have a very high heart rate. I don't know if Professor Luminoso sent you, but I will do it today when I send you that week 2 recording, a list of vital signs important to understanding children. Infants, those neonates, that first 28 days of life is called a neonate. Their heart rates are 140 to 160, and their respiratory rate is 40 to 60. By the time of 1 year, the heart rate is 100, 120, and your respiratory rate is about 30. So, why do we need to know that? Well, you need to know, are they breathing fast? Are they in respiratory distress? Do they have a fever? Do they have volume depletion? Are they in pain? All of those things will increase the heart rates. So we need to know that. What if you're giving digoxin, right? You need to know what heart rate is normal. Now, when a baby's born, they're given mom's blood, all the immune system. But the baby doesn't start making its own blood cells till maybe about 6 months. And we know red blood cells with iron tend to die. Okay. So we start out with a great hemoglobin hematocrit. And then about 5 or 6 months, it could be down to a hemoglobin of 10, where it was 14 or 15 at birth. And now it's 10. So we know that's normal. Now, at 6 months, we're going to start feeding them. When we feed things with iron in them, is if we don't give breast milk, we're giving iron fortified formula. We're trying to make up for that iron that's going to be lost with all of those cells dying, okay? Now, a baby is born with those soft spots, the one on the top of the head. You have your anterior on top, and that one should close a little over a year and a half. And then we have a posterior, the one in the back. Most people don't even realize there's one back there because it closes very quickly, about 6 to 8 weeks. Why do we need to know when they close or when they should be open until? Well, if it closes too quick, there could be problems. And if it doesn't close, why? Is there extra pressure on the brain? Is there fluid on the brain? What's causing that to keep that open? So all of these little things are clues to what's going on with that infant. At birth, infants only see black and white, they say. They do see movement, etc. But as they get older, they can see more and more. Actually, infants, one eye and the other eye, they don't work together at birth. This eye sees here and this sees here. It's called binocularity. And then about by 9 months, you can work together. And that actually helps with depth perception. Now they can reach for their toys and grab them and play with them. Their immune system, of course, is mom's at birth. But as we get older, it's going to have to be that infant making their own immune system. Okay. We know breast milk, of course, gives that immune system as we go along. But if not that, we have all those immunizations. If you had a chance to read the chapter, you see 2 pages on immunizations, and we start at 2 months, 4 months, 6 months, and we're giving a lot of them because we want that baby protected as quick as we can, okay? Because you can see it's about 9 months when that baby starts making their own immunity. And they make their immunity by getting diseases, getting viruses. The body says, oh, okay, I had that upper respiratory infection. Let me make against that virus that's coming in, and it protects them. And we know there's other things that protect them as they're going on. That cheese that they're born in, which is that vernix caseosa, that is a protection. And we know the GI tract is protected initially. Now at birth, this baby comes out of that nice, warm, wet environment, and they come into this cold world, and they cannot regulate their temperature at all. So immediately, what do? We dry them off and we put them underneath a warmer with heat, right? Because we need that warmer to help them regulate it. So they have all of this extra fluid, etc., the extracellular, and then we get rid of that. And as they get older, now they can take care of their own thermoregulation as they get older. So at birth, they might need an extra piece of clothing in cooler environments, but as they get older, no, because they can take care of it. Now, we talk about development. Well, the first thing is their hands. Fine motor, F, fingers, hands, what they can do with it. The first thing they do is mommy takes her finger, put it next to the infant, and there's a reflex palmar grasp that occurs. And the babies go, oh, look, my baby loves me. They're hugging my hand. Don't tell them it's a reflex, okay? Let them think that the baby knows who they are and they're grasping their hands, right? As they get older, it becomes voluntary. It's usually when mom is playing with a baby with a rattle, wiggle it in front of them, and they grasp it and they hold on to it, right? By 7 months, that little rattle can go from this hand to this hand. Because remember, they don't know how to do anything at birth. They can barely suck, swallow, and breathe. So this is a big thing, hand to hand. They're learning how to do these things. As they get older, their hands work a little bit more efficiently. You stick them in a high chair, and now they're eating, and you put those little puffy little things out, or Cheerios or whatever, and they take their fingers and sort of smush like that in their mouth to get a hold of them. And that's a crude pincer grasp. Well, they start to get more refined, and all of a sudden, it's one at a time. And that's a fine pincer grasp. And then about 10, 11 months, they can take things out of a container and put them back in. And by 1 year old, they should take a block and put one on top of each other. So a tower of 2 blocks by 1 year. It's all fine motor. That's what they do with their hands. And that's a test. Now, then there's gross motor. G, get up and go, go, go. I call that the Paw Patrol, right? Get up and go. What does that mean? Movement. The first thing an infant can do is have control of their head. Now, if you look at the picture to the right, you see how the infant, you're holding the hands and their head lags back? That's normal up to about 3 to 4 months. And then all of a sudden you pick them up and their head comes with their hands. Now they have head control. That is gross motor control. Okay. Then we can put them on their belly or their back. Now they're flipping over. It's first from their belly to their back, and then next is abdomen to their back to their abdomen. And then it goes up into crawling, then it goes sitting unsupported at 8 months, and then they can lay down on their back and get up and sit by about 10 months. So gross motor, it starts that way. It starts with head control. So it's called cephalocaudal direction of movement. You start with your head, and then you can sit, and then you get up and you walk, and that's caudal. Cephalocaudal, head to toe locomotion, okay? They crawl somewhere about 6 months, 6 to 7 months. They turn over first. And the reason why do we have to know when they turn over? Well, safety. You have an infant on a stretcher. You're teaching a parent about home care. They have them on a bed. The kid will roll over and roll on the bed. off the bed and on the floor. And I can't tell you how many infants came in that fell off a bed, fell off of a couch, fell off of a changing table, and they were 5, 6 months old. They didn't realize they could do that. So that's why we should know that. They start crawling about 6 to 7 months, and usually it's backwards first, and then they go forward, okay? And then creeping. That's when they're up against the couch, holding on and trying to creep around, okay? And then somewhere between 11 to 12 months, they are attempting or they are walking. Now, all kids don't do it at the same age. My children never walked. They ran at 15 months. So it's as long as all of the other fine motors going on, the gross motor, they're almost there, it shows okay. There's no delay in those children. It's just they took a little longer, okay? But they say by about 1 year they should be attempting or walking. Now, nutrition, first month, 6 months of life. We do not give any foods of any type up till 6 months because their GI tract is not mature. It doesn't tolerate it. So they're eating all this, taking all the energy to eat, and it's giving them no nutrition. So what do? We give only breast food, breastfeeding for the first 6 months, or iron fortified formula. Again, giving that iron. The breast milk with the vitamin D supplement that they take is all they need for the iron and the nutrition that they do need. Um, as we said earlier, we lose 10%, we gain the weight. One of the things about breastfed infants, especially if they had to stay in the intensive care unit for a couple of days, parents go home and are like, I don't know if my baby's getting enough because in the NICU, we could have a little bottle and we know how much they ate and we know they had enough and they're going home and they're only on the breast. I don't know what. As long as they're 6 to 8 wet diapers per day, they're okay. Also, aren't they back at the doctors in 2 weeks, 2 months, 4 months, 6 months? We're weighing them. Isn't that telling us they're getting enough nutrition also? So those are the ways that we determine they're getting enough nutrition. So as I said initially, the GI tract is not, conducive to eating any sort of fruits, vegetables, anything. They're eating it, spending all that energy. They're not digesting it, and it's coming right out in the stool, and you will see it in their stool. After 6 months, some books say 5 to 6 months, but right around there, we start introducing solid foods because now we're going to wean them off of milk, whether breast or bottle. And usually we start with the least allergenic, which is rice cereal. And we start giving them that. And we give them the food, and then we let them nurse or give them the bottle because we're trying to decrease the amount of milk and give them foods instead. Now, we do one food every 4 to 7 days because we're looking for allergies. Now, children get allergies, and we just want to make sure that we do one at a time so that we know which food it could be. We know that kids, infants get all different symptoms of food intolerances. It could be vomiting, could be abdominal pain, gas, diarrhea, it could be like an allergic reaction, or it could be to the point of anaphylaxis. So that's why it's one at a time every 4 to 7 days. And then the doctor will determine, do we need to do some desensitization, giving vaccines as they get older. Now, infants usually at birth, we can't figure out when they're going to sleep or not. That just usually the first couple of weeks, parents are awake, for 2 weeks, right? Can't get the infant to sleep, and you try to nap when they sleep, but you're always checking on them, make sure they're okay. But about 3 to 4 months, they should be able to sleep all night long. Breastfed infants need to be fed more frequently. I think that the breast milk is more liquid. It's not as solid, and the formula is more like substance in it. So formula-fed babies actually sleep longer, but breastfed infants do every like 3 hours will wake up. We know that they take frequent naps, and they do say that These walkers and swings that we think are wonderful, they're really not necessarily when they're very, very young. Although, if my infants didn't have swings, they wouldn't have slept. So, that's a personal choice, isn't it? Now, teeth. Usually they say that the first time they come in is somewhere about 6 months of age. So if a kid is 10 months, at 6 months minus 10, they maybe should have up to four teeth. Now, my kids never had teeth. They got six at 15 months. Always, that's normal, but just to know that usually the earliest is about 6 months. The thing about teeth is once they get them, we should brush them. No toothpaste, okay? So just toothbrush is just cleaning them off. And at bedtime, no bottles in bed, no propping that bottle at bed, and no juices at bedtime because that sugar will rot their teeth. They also say instead of giving them that bottle, a pacifier. And why a pacifier? I've been a nurse a long enough time knowing there's been, oh, is the pacifier is good? Oh, no, it's not. Yes, it is. Well, the research today says that that pacifier is a self-soother and that when the children have that, they can soothe themselves. So it does help them be calm and not burn calories, and they can be a happy, healthy baby. Now, sometimes it's a finger, sometimes it's a thumb, sometimes it's a pacifier. We know that all young children, especially infants, they explore the world in their mouth. It's all about their mouth for soothing them. Bunch of immunizations know that hepatitis B is the first one given. Usually that is at birth. And if it is with a mother who has hepatitis, they're going to give it usually within 12 hours after birth, just to protect that infant. And then we're going to, as we go along, I'm going to tell you which one of these you need to know. There's a lot of them. What do you need to know? I will keep you informed. I mean, influenza, that's a big thing. Like, when do we start it? That one started at 6 months, okay? Now, one of the things that can happen with children is colic. Probably one of the hardest things for parents to work with is these children don't sleep much. They're always crying. They're always cramping, abdominal pain, and you cannot, they're just always crying. They hurt. But it does stop about 4 months. It does stop. They usually change formulas many different times, trying to figure out what's going on. Trying to teach parents how to burp them, how to sit them up after feeds, rule out all the things that it could be to stop that. We have infants who sleep a lot. We have some that don't sleep enough, and that's normal. And then we have something what you call failure to thrive. This is the infant who eats, who doesn't gain weight. Is it metabolic, or is it that they keep spitting up their food, like with reflux, GERD, right? That could cause it too. So if a child comes in that's not 14 pounds at 6 months when they weighed 7 pounds at birth, it's a failure to thrive. Is it the formula? Do we need to look at that? Is it something metabolic? Because if they're not getting nutrition, their brains are not getting the fuel they need to be as smart as they should be. Now, today, because of SIDS, we have all of our infants on their backs to go to sleep. We have found through research, it used to be on the side many years ago or the back. Today it's only on the back. And sometimes the back of the head, they lose their hair, and that upsets parents, especially little girls. You don't want that little bald spot, and it causes a flat head. What if a parent's having a problem with this, plagiocephaly, this flat head thing? Well, when we're infants, we have infants doing what we call tummy time, right? They get on their tummy and they're trying to move and wiggle. They're moving their muscles and trying to get to their toys and whatnot. Okay. Just that little time, couple times a day, will help that scalp round out. Those scalps are so soft, malleable, and they will round. Now, there are some cases where, let's say it was a child in the newborn ICU and they were on the side of their head because of their condition. we will put those helmets on, like that right lower one. And that helps protect the head so it can round out. So it is a choice. Sometimes we use it. Now, dermatitis, diaper rash, that burns and it hurts. Probably the biggest reason why children don't sleep at night. You put them to bed all nice and dry, they urinate stool, and it's acidy and it gets on that rash, and the kids are awake, right? So, diaper dermatitis, why is it? Is it the food? Did you just start foods on the infant? Did you change diapers, change lotions, change creams, all of those things? I found out my kids do not like huggy diapers at all. They only wanted Pampers. So again, it's figuring out why and preventing it. Sometimes just during the day, leaving them open and letting it dry will help it heal more, even beyond just putting a lot of creams on it. And then cradle cap. It's a seborrheic dermatitis. Some infants are born with like all of this crust on their heads, and parents want it gone right now. So, how do we treat it? Well, you're still going to wash it with baby soap and water because they still need to be clean, but we're going to put some sort of oil or lotion on there. Some books say olive oil, some say the baby oil, some say put it on overnight and then bathe them in the morning, and then a fine tooth comb very gently. Now, it's not going to disappear in one day. It could take a week, but again, it's just every day being consistent with it. As I said, SIDS is a big thing, first year of life. We don't know why kids are sleeping and they stop breathing and they die. And what are the risk factors? Well, some is male more than females. Breastfed babies have a less chance of SIDS if they're on their tummies, cigarette smoking in the house, if they're too hot. What if they just had a little runny nose, upper respiratory something? Remember, suck, swallow, breathe is like a really hard thing for infants. It can cause SIDS. What if it's, um, putting them in the bed with you? I've seen parents roll over on infants. Unfortunately, I've seen them die that way too. Hard, mattresses it should be, nothing in that crib, no blankets, no bumper pads, no toys. A nice firm mattress is what they do need. Now, safety promotion, I think the first thing with infants is going to be that car seat, getting them home from the hospital. Remember, rear facing in the middle of the car. We like to put them behind the passenger seat, right? Because we want to be as that driver to be able to see over, right? But in the middle, because from the sides they can be hit. Another thing is today they're doing CPR on pregnant women at their last trimester, making sure that they understand. And then water safety. I live in South Florida and I've seen drownings and it's pretty scary. I had my grandson for the first 3 years of his life lived with me, and I have a pool. So by the time he was about 8 months old, he was in the water with me. By 1 year old, he had no floaties on. And by 2 year old, he was doing front flips and back flips in the swimming pool and no swimmies. Now, he would be with his head sort of sticking up, but he knew how to be safe. And that child is now 7, and he will never, ever go near the pool to go in without asking first. So again, it's that safety and us as healthcare professional teaching our parents about how to get them safe. So Latasha is a breastfed infant being seen at the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Is it wrong for this child to be sucking her thumb? What does that thumb sucking do for that child? It helps relieve stress, right? There's no pacifier there. She's done it herself. So it's absolutely normal and it's okay. Now, I know infants, they worry about them getting older and their teeth and the crooked and whatnot. Yeah, if there's a pacifier, good, but usually we stop that thumb sucking. before their permanent teeth come in. That's what they say. So, theorists, this is probably going to be some of the hardest questions on your exam to figure out. I'm going to try to make it as simple as I possibly can, okay? So, Erickson's all about the people and the environment around them. Psychosocial. Well, who's around an infant at birth? Mom, dad, and grandma, right? So, what does an infant do? What can they do? Well, they can cry. And why do they cry? I want somebody. I'm hungry, my tummy hurts, and I'm wet. Or I just want to be picked up. When a person goes and picks up that infant pretty quickly, that's when an infant gets that sense of trust. They're healthy, they're happy, they're a happier infant. Now, there are cases where babies cry, 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 and nobody picks them up. It could be in an abusive, environment, drugs, alcohol. It could be a homeless situation. It could be many things. Well, they get into what we call mistrust. So Eric's infant is trust, somebody gets me, versus mistrust, nobody picks me up. And it gets to the point in that mistrust where they absolutely stop crying because nobody's coming for them. So there you see them sort of withdrawn, and infants do that. Now, Piaget is about thinking. Well, what does an infant know when they're born? Nothing. They barely know how to suck on a nipple to feed, right? So we have to teach them how to feed, how to suck, and how to swallow, and how to breathe. I mean, that's the first thing. Well, then what happens? Well, you give that baby a rattle, and then they get that voluntary grasp, and they have it in their hand. And all of a sudden, they move their hand, and that rattle makes a noise, and they go, "Oh, I like that noise. That's pretty cool." And then they put it in their mouth. And oh, that's really good. So they've learned how to do that. Next time they get the rattle, they'll shake it and they'll put it in their mouth. They're learning, they're learning, they're learning. Now, they also can imitate, if you take a parent and they're looking at them and they're giving them kisses or sticking your tongue out at them. That infant's going to try to do those same things. It's all part of that play. So Piaget is about learning, it's cognition. I know nothing at birth. I need to learn how to be in this world. So there are now, the hardest thing I think is these names and what do these names mean? So sensoriomotor, the basis of all play. That was a question on your quiz. Play is all about touching and feelings of what they're touching. It's all about their mouth, oral, and movement and playing. And it's all of that imagination that goes in between. That's sensoriomotor. Pre-operational is a little bit older, and now they're learning more. And I'll give you examples. So they're sitting in a high chair, and they knock off their sippy cup by accident. And mom comes running over and picks it up and puts it back on the high chair. Guess what that toddler just learned? Next time I want mommy, I knock off the cup, and guess who's going to come? And there's mommy, right? How they learn is through what they've done. Okay. They have to do it to understand it. And as they get older, you'll see concrete operational school age. This is next week. And formal adolescence, is also next week. And we talk about how concrete, it's there, it's physical, it's concrete. You touch it, feel it, see it, you know it. And, adolescents, they can say and figure out anything to get what they want, right? That is being able to think. Now, infants start learning who they are, they start sucking their toes, they start looking at mirrors, and they start with understanding what we call object permanence. So, what does that mean? That means you have a rattle and they saw it be put down somewhere, but it's covered up. They still know it's there. Even though it's not in sight, not invisible, they know it's there. It's object permanence. You take the toys of a kid, put them in the toy box. The next morning, The kid comes out and he knows the toys are going to be there. Object permanence, okay? We know infants, initially, they don't care who they go to, but about 4 to 8 months, now it starts with what we call separation anxiety. Now, there are 3 stages of separation anxiety as children get older. And initially, separation anxiety, you pick an infant. Now, if you're lucky, you've had, your maternity leave and you've been able to stay on with your infant for 3 months, you're lucky. Then you bring them to a daycare. What does the infant do initially? Cries, cries, cries. They want mommy, 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 right? And then eventually they figure out, all right, mommy's not coming. They're all right. And then many times you go to pick them up. They don't even want you because they're happy where they are now. That's separation anxiety. And as they get older, the same sort of things happens. Stranger fear. They don't wanna go to you. 8 to 9 months. Well, they say 6 months. Could be a little bit even a little bit older. All of a sudden, you're trying to as a nurse, let me weigh your infant, your child, get them up to pick them up, and they're like, I wanna go back to mommy." Their hands go there. But then about 9 months, you're peeking around the corner, right? Who are you? Let me figure out who you are." And we know as they get older, language is developed. Initially, it's that cry, and then it's that cooing that they have, right? And then they get that little giggle. So this is all language development. And children, even us adults, what do we do all the time? We play, right? We can play, and playing helps children learn. So toddlers, ages 1 to 3, probably my favorite group of kids. These are the kids, and I love what Jerry Seinfeld says. Having a 2-year-old is like in having a blender turned on with the lid off. They're everywhere all the time, and you can't keep up with them. They're into everything. Intense exploration. They're also me, me, mine, no, 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 no. And that's exactly what these toddlers are. Now, we've gained triple our birth weight as an infant. We do not quadruple to 2.5 years old. So you can see their weight has slowed down, their height has slowed down. We know that they're these little pudgy infants when they're up to 1 year old. And then all of a sudden they start to walk, and now their legs are getting longer and they're becoming less and less clumsy as they're trying to walk around. Another thing is remember in maternity, babies are born, their heads are bigger than their chest circumference. By about a year, year and a half, their head and chest should be equal or their chest should be bigger. This is one of the assessments that we'll be looking at. Another thing at age 2, your child is half their adult height. So you can figure out how tall your child's going to be. Body systems are more and more mature. They can eat different things, right? Their GI tract, that's one of them. Just think about these children, they're having all of these upper respiratory infections. They're having ear infections. What is their body doing? It's getting all these antigens and it's, protecting themselves. I mean, why do they have all of these ear infections and whatnot? Well, they have short, straight, open eustachian tubes. What do infants, well, the toddlers do, ages 1 to 3? How do you explore the world in their mouth? You put them in daycare around other kids. What do? They share toys. They swap spit all day long if they're at a daycare. They're swapping germs. And that's just absolutely normal here. Okay. They're able to start to learn to control their bladder and their bowels. Remember, vowels are the first thing that they're able to control, then it's going to be their urine. Their gross fine motor is getting more and more adept. They're able to use both hands. They're starting to throw balls over their head by about 18 months, and their vision's getting better, which means both eyes are working together, not separately. So depth perception is quite much better than it was. Another thing that happens with toddlers is that they start to become picky eaters. It's because their smell, their taste becomes a lot more attuned. Have you ever tasted your baby was on formula? Did you ever taste what it tastes like? Ooh, it's disgusting. Especially some of these fancy things like alimentum, right? Those things are ooh, a Nutramigen. Ooh, they're not really good, but the infants don't taste that yet. Now, the toddlers do. They become extremely picky. But the one thing to remember and to teach our parents, toddlers only need 1 tablespoon of food per year of age when they sit down to eat. So it's really not that much that they do need, okay? Now, Erickson. So infant is I trust you because you get me. I mistrust when you don't. When it comes to Erickson and toddlers, it's about the child. Autonomy. Automatically me, mine, mine. That means I want to do it. Let me try. And that shame and doubt is when somebody does it for them or doesn't let them try to do something. As a parent, it's easier to get them dressed, to put their shoes on, to do whatever for them. We shouldn't do that. They're autonomous. They want to do it. Let them do it by themselves. It doesn't matter if they're getting dressed and the clothes are inside out or backwards. It's the attempt that they tried, and we should never make them feel bad that it wasn't correct. Okay, just show them, oh, here's the tag. It should go in the back. Let's put the tag on right so it feels good, not to make them feel bad. The shame and the doubt is when, gee, I don't know if I can or should I try that because they're not going to let me do it anyway. Okay. As I said, negativism, no, no, me. And the biggest thing with these toddlers is they need that ritualization, which means a schedule. They know when they wake up what's going to happen. They know the foods that they're going to be given. When's a nap? When's bedtime? And why do we need to know that? What if you have a toddler in a hospital? You need to know what they are used to at home. And when you do that and follow that, it's a happier child. And that's what we want. So, Piaget. All right. So, there are different things and different words that we use. The one thing I just want you to know about Piaget, it's learning things. When it gets into tertiary circularity reactions, this is things like I have a broom, I get on it and I ride it, and this is my horsey. I put my hands out and I'm zooming around the room and now I'm an airplane, okay? These are things that they don't know time yet. They don't understand morning, night. It's very, very simple now. They just know it's time to go to bed. They don't understand that yet. Preschoolers is when we start to get a little bit about time. So remember Erickson, it's all about I want to do autonomy, automatically me, mine. Okay. And it's all about being in the rituals. And then the cognitive development, it's all about figuring things out, how things work, and then using arms and things to recreate, what they want to play with, whether I'm now the airplane, I'm the car, I'm a this, I'm a that. And there's more about what I just said. Another thing is they're going to start now touching themselves. It could be, oh, they found out they have a penis in there, or, there's something's in there and they're just touching normal. They're exploring with their world. They're starting into understanding that there's a mommy and a daddy. And mommy does certain things and daddy does certain things. They're starting to figure this out. Because why? They're potty training, right? Mommy sits down and daddy stands up, and I'm a boy. Oh, I should stand up too. Let me daddy show me what to do there, right? They're starting to get at what that thing down there does now. They understand, as I said, the difference between mom and other people. They know who's the people, their auntie, their nana, whoever, is that person they can be with. Also, one thing that we need to know about these toddlers is if they're in a hospital and mom has to go home, and you need to understand what's their favorite pacifier, or their binky that they need to have, or that toy, or maybe it's that special blankie that they have to have, and those things can help them comfort themselves. Language is getting more and more better. They understand a lot more than they can speak. I find it very frustrating for them and even adults where you're trying to figure out what they're saying, but they don't have the words to tell you. So many times I would say, show me what you're trying to tell me. And that does help. As they get older, of course, they're going to speak more words and express themselves better. They want to be independent. They want to feed themselves. Even if the spoon is upside down, backwards, not right, hand in the mouth, whatever, they want to do it themselves. When they play, this is the group that's in parallel play. They like to play, sure, next to each other, but don't you touch my toy. And oh, you don't touch my toy either. No sharing, but they're playing next to each other. Parallel play, okay? They don't know how to share. Mine, me, okay? As I said, play, very important. They learn a lot of stuff, right? They're gonna do that parallel play at first, and give them all the things they need, all of the textures, where it's sand and mud and dirt and all of these things are great. It's that tactile stuff. Potty training starts, as I said, bowels first and then bladder. We know that they have sometimes, let's say they're a toddler and they get a new baby brother or sister. There is going to be some rivalries there. Absolutely normal. They have temper tantrums. They sit down and, yep, they're gonna, have a moment. And I always say that let them have that moment as long as they're not hurting themselves or their others. As I said, it's always no, 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 me, absolutely important. And when toddlers are stressed, maybe it's that toddler who's already potty trained or already, doesn't use a pacifier. All of a sudden, the thumb is in their mouth, and now, they had an accident. And, that's telling you this toddler is stressed. As I said, nutrition, they're not eating much. I call it the physiologic anorexia. These kids, I remember coming home, my husband was watching my grandson for a while, and I'd come home from work and he said, well, he only ate this and this and that. And I'm like, that's more than enough. He goes, no, he needs to eat more than that. I'm like, no, he doesn't. So parents have a hard time because by the time they get about 1 year old, they're eating like crazy. But look about the amount of weight they're gaining. They've tripled their birth weight in the first year. So they do eat a lot. Then all of a sudden they stop. Whole milk started at 1 year. You can stop the breast milk and you can stop formula. Whole milk at 1 year. Okay. And remember, whenever we have any age person, if they have a problem that they have some sort of wound or surgery, remember protein is always important for wound healing. Okay. Dental health, we know that they need to floss when they're old enough. We know that toddlers aren't yet. We're going to have to do them for them. It's after the age of 6 that they can floss themselves. They can have fluoride. And remember that they should brush their teeth, before they take naps, before they go to bed to get that sugar off so they don't get those cavities. You have to be careful of them, everything in their mouths. There's always those safety things under the age of 3, small item things. Got to be careful with that. Also, things like you don't think of like lead poisoning, in older buildings. What if the little toddlers do? They stand up next to the windows on the window sills and they chew on them, right? They're teething. What if it's old paint? What if it's lead in that paint? you have to be careful for it because they can get lead poisoning and they can have to need to go through chelation therapy, which could be medication, or it could be like this machine pulling blood off, getting the lead off back in, similar to a dialysis, but it just removes just a certain particle off. Most common things are cosmetics, household cleaners, and all different things. I actually found in my career, working in the last 10 years of my career, was at an emergency room. And this emergency room was in the triage area a lot. They love their vitamins. And as long as they weren't iron vitamins, they were okay. The problem happens when they had things like acetaminophen. Now you're worried about liver damage, right? Or grandma's heart pills or whatever. Those things were the bad things. Now, the one thing as nurses that we should always recommend is make sure they have poison control, that number, and it should be at on their phones to ready to dial right away, one of their favorites. Because today we don't induce vomiting. Years ago, it was Epicac. Oh, no more. All right. Most of the time, if they, vomit, they could aspirate it and create more problems. So again, it's causing poison control, getting them in to a center where they could deal with pediatric poisoning emergencies. Safety emergencies, we've talked about car seats, we've talked about drownings, falls, we've talked about at 6 months, be careful. They're going to fall off of couches and beds, etc. Again, worried about inhaling little toys, etc. Now, preschoolers, ages 3 up to ages 6, and at age 6 we start the school age. This is when we start the idea of these children. Now, if they're playing, there's going to be times where they're going to have to sit and pay attention to a teacher. So, we've got to get them ready as parents. You know, reading books to them, usually that bedtime routine, but reading them a book is probably the best time to do those things. And giving them that good attitude to learning and understanding more. And you're separated longer from those children, and that child has to sit for longer times than they've ever done before. So it's a big deal for these kids. Again, you're still not growing too quick. You're still slow. You get a little taller, then you get pudgier. Then you get taller and you gain that weight and you're pudgier. Then you get taller. Absolutely normal. The difference between toddlers and preschoolers can adjust to stress and change a lot better than do toddlers. Their gross motor, they get up and go, go, go. Their muscles, they're doing more. They're walking, running, climbing, and jumping. We can do all those really well now. Their fine motor, they're doing more. These children now can button shirts. They can draw circles. They're starting to color. All of these things they're doing now. Now, Erickson. Eric is a sense of initiative. And they want to do things and help people, but they're afraid that they're not going to do it right. Okay? They're also learning if they do something wrong, gee, now I've got a conscience. Now, there is a theorist, Kohlberg, sort of about right and wrong, but it's different than this Erickson. They just know that you do something wrong, they're going to know about it. Or if they do something right. Erickson doesn't go into it a little further. And in a second, we'll go into Kohlberg. Now, as I said, cognitively, now we're getting ready for school and getting them positive towards it. Getting those kids together. They're going to be in a room with a bunch of other kids. Now they have to socialize and get along with all of these children. So Piaget. So now we're starting to think a little bit better. They're being aware of the environment around them. They're being aware They're starting to talk, they're communicating better, and now they're starting to understand a little bit about time. Now, how do they understand time? It's not a clock. After lunch, daddy's going to come get you. My grandson used to come over and spend time with me, and I used to he goes, "How long am I gonna be here?" "You're gonna be here for 2 morning times. 2 times the sun comes up, you're gonna be here," which was 2 days. That's how he knew. When you wake up in the morning, we're getting in the car and we're going on vacation. That's what they know. They don't know 4 o'clock, 12 o'clock morning. No, they understand events that go with it. They're also into magical thinking. They are such the cutest kids. They're starting to figure out the world and they're playing and they have these two things and they're talking to each other and they're making their own little stories. It's absolutely fun to watch them play. Now, Kohlberg, right, wrong, and a consequence. Preschoolers, reward and punishment, right? Reward, I did something good. Punishment, oops, I didn't do well at all. They're starting to learn about their bodies, the blonde hair, the brown hair, the blue eyes, the dark skin, the light skin. There's differences. They're starting to know. The other thing is they get falling down, they get a scrape and something's bleeding. They think their insides are falling out and they're going to die. Give them a band-aid and you cured everything. It's the age of Band-Aids, and they don't like stuff to go in. For instance, this could be a time where needles are very scary because it goes into them. They feel it's gonna go in there and make them dead. I mean, this is part of it. They're starting to understand spirituality and religion, but it's what you as a family teaches them. They don't understand more than the family right now. They understand it. Is it Santa Claus or is it going to church and the manger or is it both or whatever the religion is? That's what they understand. And they also think that if they get hurt, broken arm, they fall down, they're being punished from whoever that higher power is, God or whatever the name of it is that you call it. This is part of what they believe. Girls like their fathers and boys like their mothers. It's just part of what it is. They're also into wondering about sex and babies and where they come from. And this is something that you have to ask them first. What do you think it is? You don't go into detailed descriptions to them. They're not as much into that stranger anxiety, separation stuff as they were when they were younger. They understand more. And one of the ways that, especially a child who's in a hospital or a repeated, has to go in a hospital multiple times, play therapy can actually, they can work out what was it that scared them and made them frightful in a past experience in a hospital or whatever. And these children, again, they have their special toy, their special blanket, their special pillow, whatever it is. This gives them security and makes them feel safe. Their language is amazing and they get these words. Teleportation was a word that my grandson used to use, and I don't even think he understood what it meant back then, but it's something that he used to always use, in every other whatever you asked him about. So again, language is getting more, vocabulary is more, they can express themselves better. It's quite impressive. They don't need the same routine as toddlers. They aren't the no, no, no kids. As in parallel play only, that's your toddlers. These children will do associative play, which means two or more kids playing together, working on toys together. Now, there's no goal. They don't build a house. They don't play checkers and somebody wins, but they're playing together. It's associative play. These kids love that. They can dress themselves. Doesn't mean it's done right, but they're dressing themselves and they love to please. And they only know the parents, the culture, the way that they are. The please, the thank you, whatever the parents are, is what exactly what they do. And of course, they're going to challenge all the time. Well, you don't have to do that. Why do I have to do that? Well, your brother's older than you. As I said, associative play, all playing together. Imitative, of course, show 'em what to do, they're gonna do it. Imaginative, I think it's all the time with these kids, thinking about, the toy is now flying in the air and saving the world, you know? And of course, dramatic play is when you can find out those things that happened, maybe in a hospital that scared them. Tell me what went on there. And of course, playing together. They're afraid of the dark. You have to turn all the lights on now. Don't like to be left alone. Don't walk out of the house, go get the mail. Don't tell the child he's in the house alone. You walk back in the door and the kid's screaming because, where did you go, Nana? I didn't know where you went to. I was so scared. This is just part of preschoolers. They're afraid that you're gonna do something to their private part, this castration, and they're afraid of people like us nurses, people associated with pain. What do? We give them injections almost every time they come to our office, right? So sex education, again, you want to know what they know and just guide them and giving them a good enough explanation for them to understand. They say that you should use correct anatomic words. I mean, my grandson knows a penis and a vagina, and that's normal to him to understand those words. And then they are into masturbation. Now, they don't know when and where to do these things yet. So if they're playing with themselves, it should be, okay, do you have to go to bathroom or does it hurt there? No. All right, then just go in your room. I don't need to watch you there touching yourself. But it shouldn't be making them feel bad, okay? Because it's a normal part of life. Sometimes young kids do have speech problems, and we would know that because we know that they're not speaking the amount of words. They're not doing what they should do at that age. And then it's that early intervention. And what that is making sure that they get to that speech therapist, making sure that they get the help they need, and checking their hearing, making sure they're hearing so they can speak correctly too. Some kids do have nightmares and sleep terrors. My second grandson had them, but he wasn't awake. It looked like he was awake, eyes open, but he wasn't there screaming and yelling at night. Some of them need medications for it, but it's normal. They will outgrow it. Making sure safety, injury prevention. I mean, injuries with these kids out running around, falling down, riding bikes, make sure they have the helmets and elbow pads and knee pads and whatever they need, protect them. And the one question about any injury on any age child will always be the largest area is always motor vehicle. Okay, always motor vehicle accidents are the highest level of injuries of all age children. So, families, we know now that these children have to do more. We need to explain to these children about dangers. These children are going to have to teach them not to be careful of cars, not run behind them. They're in a parking lot, a street, hold hands, look both ways, making sure that they're taught and to avoid those things. Remember, these children are about to enter school, they're going away from you, and as parents, we need to educate them to teach these children. So, communicable diseases, we know that because of immunizations that they have decreased, but they're always going to be there. And one of the things that we do ask on admission, whether it's to an urgent care, ER, doctor's office, a hospital, are your immunizations up to date? Because you have an upper respiratory. you don't have immunizations, I, as a nurse, I'm going to put on a mask. I want to make sure I'm not going to get something like a pertussis or something that is, something that could be prevented by an immunization. So, and then again, communicable diseases is always hand washing is always a number one. Pink eye, conjunctivitis, big thing. They don't wash their hands and their face, and they get these goopy, eyes, especially in the morning. Just, make sure that we wash them warm, uh, a compress, a washcloth, and from the inside out, get rid of them, to help prevent them. And the one thing we don't forget, if you're using an eye ointment, let the child know that their vision will go blurry because they'll get scared. Say once it melts in there, your eyes will see okay because they get scared. And the one thing, and it's not in a book, it's just what I teach parents. You have a child with pink eye, make sure they change their pillowcases every night, or they're going to keep recontaminating themselves, right? It's something that I've learned throughout the years. And again, hand washing. We can have roundworms, we can have fungal infections, making sure that we diagnose them correctly. Pinworms is as simple as cutting their fingernails and washing their hands. And if they have this intense itching, especially at night, that we do get that sample and we do get them on medications and we check the family for it also. One thing that we don't think about, and I've seen quite a few cases, is childhood neglect and physical abuse. And it does happen. Always remember, as a nurse, your responsibility is to protect the child. If you think a child's been abused in any way, tell your charge nurse. And if like I was in the emergency room, tell the head physician something's going on here. It's not right. So protect the child. I've seen not nice things in my career, and I've seen them go either way with outcomes. Another thing is mush housing syndrome. This is when a caregiver keeps a child sick to get attention. And it could be them bringing them food in that keeps them sick. It could be they have, let's say, an infected wound. They keep putting dirt and stuff in it to keep it sick. Or they have an IV and they're injecting toilet water in it or things. Crazy, crazy things happen. Now, the kid doesn't need to be under 24-hour observation by nursing. They only need it when that caregiver is there, making sure that caregiver is not hurting the child, and inspect anything that they bring in, making sure that that is not keeping them sick. Mush housing syndrome is real. It does happen. So the parents tell the nurse their 3-year-old daughter and a male cousin the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? Remember, they're all into inspecting, masturbating at that age. What do you think you should do? You want to draw attention to it. What do you think?
Is it B?
B.
Absolutely. You don't condone, you don't, condemn it. Say, come on, guys, let's go get something to eat. Let's go play. Let's do this. Let's do that. Get them away. And then, of course, don't let them go in the bathroom again. But these things happen. They are normal. Okay, let's go to Kahoot times. We're doing good. As we set up, I'm going to quick run to the ladies' room. How does that sound? Has everybody done a Kahoot before? So what you can do is point on that little code up there and it will get you right to your need to be. Be back in 2 minutes. Mhm. So these cahoots, I don't look at, I don't see who did what, when, or where. These are here for you. The concepts in here, you're going to use them on quizzes, exams, and you're going to see some of these questions on HESIs. So they are very important part of this course, okay? Worked very hard on them for you. Week 2, it's going to go by quick. A multi. Types of play considered to be sense pleasure play. So remember, all components of play are sensory, oral, motor. Sense, touch, feel. What is it like? I mean, what do kids do when they're eating? It's smushing in their high chair all over the place in their hair. I used to always do their baths after their dinner and let them smush it everywhere. It's just really good for them to play with it. The nurse notices white patches in the mouth of an infant that cannot be removed with a tongue blade. What are you going to do for that? What do you think that is? So, some of the questions in the Cahoots are something I just can't put everything into a PowerPoint. So, I will put it in the Cahoots so that you can mention it, that you can see it. Another word is that ungle, it's thrush, and it's something that needs to be treated with nystatin liquid. Now, an infant, you can't swish and swallow, can you? Must take a swab the tongue, that white area, and that's how you would do it for an infant. What type of play is considered cooperative play? So there's parallel, associative, and cooperative. Those are three biggies that you're going to see again and again and again. So parallel play is your toddlers, associative play is your preschooler, and then your school age is all about sharing toys with another kid, right? But it is with a goal. So, two or more children with a goal in the end. I'm going to build a sandcastle or I'm going to make a house. That's cooperative. There's a goal. Associative, they're just playing with no goal. They're just playing with toys. That's the difference. Okay. According to Kohlberg, pre-conventional level of moral development. The preschooler has moral reasoning. What? Remember, Kohlberg's all about morality. What did I say about morality? We know there's good, there's bad, there's reward and punishment. So it's either good or bad, and it has a consequence. School age children want to please each other, but preschoolers just know good and bad, and there's going to be a consequence reward, punishment. Which nursing action is appropriate to teach a preschooler child about a scheduled procedure? Now, one of the things about working in pediatrics is how to approach children. Number one, you've got to sit down below them. You've got to get on their level, their developmental level of understanding. And then you can use things and items to teach them, like use a doll to explain the procedure, or let them touch the stuff. But as I said again, get down on their level, don't ever stand above them, get below them, get on their level of developmental understanding, and then let them touch or feel and explain it. And now you're less threatening. Before performing a physical exam, Assessment on a toddler, the nurse should do what to encourage cooperation? I worked in a busy ER. I would have 4 children at a time, and a lot of them were toddlers. How am I gonna get this kid to do what I need him to do as quick as I need to do it? And it's literally use minimal contact at first. I get down on their level. I get that rapport on their developmental level. Maybe it's a kid that I give a sticker to, or I just tell them, use where's your ears or eyes, play with them, things like that. Taking 2 minutes saves 20 minutes in aggravation, and it really, really works. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? Like that. What do you think this is? It's absolutely pain. And it's that unconsolable, inconsolable. That's absolutely pain, okay? Good job. Oh, no, they're multi. Erickson describes infants as trust versus mistrust. What does trust mean? So I cry, somebody picks me up, changes me and feeds me. I'm secure. I know what's going on, and I am happy. If they cry long, that's mistrust. They don't know what's happening, and now this is not your happy baby. A 3-year-old child is having an outpatient procedure. How would you help the child to be less fearful? I went to work for 20 some odd years in pediatrics, and I played with kids all day long. It's been, the best that I could say. I got to play every day. So use a doll, you give them the equipment, do whatever you need to do, let them know what's going on. After you got down on their level, on their developmental level, got their trust, and now you can explain it with a doll or the equipment. A multi. You need to do an assessment on an infant, and you walk into the room, and the infant's asleep in the mother's arms. What are you going to do now? Now, the one thing you need to remember with children, it's never, never, ever a head to toe assessment. It's not going to happen. These are adults. You need to do what you can do when you're allowed to. With an infant asleep, you can listen to their heart and their lungs because they're not cooing and moving and switching around, and you could get a good listen and a good assessment. Okay. When do you switch formula or breast milk to whole milk? Or when can you? And the reason why whole milk is they, even if it's a big baby, is because they need the fat for their central nervous system for good cognition. Okay. That's why it's whole milk. And yes, it is at 12 months. At 6 months up to 12 months, you're introducing food, but they still have breast milk and formula. Sorry. When teaching about car seats for a newborn infant, so you can gently use less than a year old, new ones, absolutely rear facing in the back seat, but you can't use old ones. They do expire. And remember, as toddlers at age 2, you can turn 'em around front seating. They say 2 or 30 pounds. Now, my grandson was 25 pounds at 2. He was always a peanut. Now, the pediatrician said it was okay to turn it around because it was motor control and head control, neck control, why we could turn it around. Gabrielle, you got a question?
Yeah, for car seats, isn't it also true that if you've been in a car accident, you have to
Change
get a
it.
new one? Okay.
Absolutely. Absolutely. Because you don't know the integrity of the seat. Because the goal of a car seat is to protect that child. So, yes, absolutely. Very good point. Very good. Thank you. A multi. When and how do you introduce solid foods to infants? Funny part is that used to look like my son every dinner when he was finished, head to toe, even beneath his hair, because that used to be bath time too. Let him go for it. Used to love it. Introduce them at 6 months, one at a time, 4 to 7 days in between adding another. You never add two together because which one caused an allergic reaction? You wouldn't know. Before assessing a 4-year-old child, what techniques would you use to approach this child? So again, 4-year-old children, you've gotten down below them. You start up a conversation. You start talking to that kid that you like Batman too. Let me tell you, this kid's going to open up and start talking. And it does, it opens up that report. It's on their developmental level. They're wearing Batman. They probably know who Batman is at age 4. What technique can be used to examine a toddler? Mhm. So what you're going to do is use play. We're going to talk about body parts for these children. Again, using play after you got down on their level. When assessing a healthy child's lymph nodes, what should you expect? You shouldn't be able to feel a healthy child's lymph nodes at all. The lymph nodes are going to become enlarged when a kid is sick because that's their immune system. It's telling you something's going on. So besides that, healthy, shouldn't feel them. Which Erickson stage of developmental levels would be used for a toddler? What are toddlers all about? Not the me, mine, I do. And that is automatically me, mine, okay? Versus shame and doubt. Good job. What pain scale would you use on a 3.5-year-old child? And yes, absolutely faces. At age 3, it's faces. From 0 up to 3, it's FLAC and nonverbal children. That was a question on a HESI about nonverbal. What scale would be used? That's why I'm very, telling you that absolutely it's 0 to 3 and nonverbal. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So they can try new things. They want to do it by themselves, right? Yeah. Can they play by themselves? You got to still make sure that you're protecting them from danger. Okay. But the shame is when we don't let them try it by themselves. They need to attempt it. It's how they learn. A 2-year-old boy is playing with mud and dirt. What type of play is that? And that's what we call sense pleasure. It's that touch thing. A parent of an 18-year-old boy says he says no to everything and has rapid mood swings. Is that right? No? What is that? Absolutely normal. Me, mine, I do. And yes, they're extremely moody. What's descriptive of a preschooler's understanding of time? Is it 12 o'clock? And they understand time with events. After you wake up from your nap, you're going to go to grandma's house. In the morning, when the sun comes up, we're going to get in the car and go to Disney. Whatever it is, that's what they understand. They don't understand clocks. An infant's crying and they're shaking their head. What feature of pain is the infant showing? Why would they shake their head? Bang their head. It's all about location. It could be the ear. I mean, they could be sticking their hand down their mouth. That's going to be throat, but shaking their head could be that location in their ear. A 1 month old infant's back of their head is flat. What would you tell the mother? She's concerned. Why is my kid's head flat? I want to have a kid with a flat head. And that's all about putting them on tummy time. It will round out by itself. Very good. A newborn's mother has type O positive blood and the infant's B positive blood. The infant is at highest risk for what? Has to do with their red blood cells and them bursting and being immature. And this is something that's common in a newborn child. And it's hyperbilirubinemia. Now, this is when the skin turns yellow. This is a kid who goes under a light or has to go in sunlight. Do you know the easiest and quickest way to help prevent that from happening is to put them to breast or start feeding them? They lose that bilirubin, which is the end product of those cells bursting because they're different cells. They burst. You give them food, it's in their intestines, they get rid of it, and they'll keep those numbers a lot lower. If it's still high, then it's sun, or it's that light they go home on. Which intervention may decrease the incidence of physiologic jaundice in a healthy term infant, that hyperbilirubinemia. Remember, we get rid of it. The quicker they start moving their bowels and stooling, the quicker it goes. And you do that by feeding them. Now, you're not going to put any infant underneath the sunlight in a window because it still can get that child burned. Okay. It has to be very regulated in the amount of time, etc. But feeding them quick, frequent, makes them stool, gets rid of that bilirubin. Those levels come down. Which intervention lowers the risk of sudden infant death syndrome? This is when you put them back to sleep or supine. That is what they say today. And it does work. Infants crawl before they walk. This pattern of growth and development is called. They lift their head, they turn over, their front to back, back to front, they crawl, they creep, they walk. It is part of the way that they are growing and developing. And it's called sequential trends because it happens in a sequence. It doesn't mean they might, hop over and not do all of them, but they're moving forward. That's the sequence. How do you communicate with parents that don't speak a language that you know? I came from New York and there was no other language up there where I was from. And I moved to Miami. So I actually went back to Miami-Dade actually and learned Spanish. But the appropriate thing to do is to do those telephone interpreters. Don't ask somebody, a child or a relative, because they're going to put their opinion or feeling on what that parent said. So you go to that telephone interpreter. What age would most children understand under, on top of, beside, around, over, under, and back of? And the one thing, if you do have children, the hardest part is not to think of what they did because it is always different than the book. And it is 4 years old, according to the book. Now, did my kids do it at 3? Yes, but the book says 4. In terms of language and cognitive development, a 4-year-old child would be expected to what? So, thinking, talking, thinking. What should they be able to do? They should be able to follow simple commands. Get your shoes and go put them in your room. Get your dirty clothes, put them in the laundry. Let's come to go wash your hands. Let's get ready for dinner. They should be able to do that. They understand that. What pain scale would you use to assess the pain of a toddler? Ages 1 up to 3. Black. It's absolutely flack. Remember, faces does not start till they turn 3 and then up to age 8, and then it's numeric. A multi. What safety instructions would you teach the parents of a 6-month-old child? What can a 6-month-old child do that you would have to be worried about? Again, knowing about gross development. This is the gross motor development. What are you concerned about? And you want them in that car facing, car seat facing rear for sure. Yes, they're a little bit motor, so get those electrical outlets covered. And of course, don't leave them anywhere alone that you roll off and onto a floor because they can get hurt. A multi. What are the cognitive characteristics of a child ages 2 to 7 in the preoperational stage? So this again is thinking. How do they think at this young age here? This is where they don't know other people. They're not logical at all. That's not yet probably up to almost adolescence, but they're using their arms as being in a plane or a broom is a horse, and they're so extremely imaginative. This is the way that they think at that age, and that's Piaget. A nurse receives a phone call from a mother about her 6-week-old baby, and he's crying a lot every day. What can she do? I mean, the kid's crying. Well, remember the kid's 6 weeks old. They don't have an immune system. They're extremely brittle at this age. What do you think we can do? What? Change the formula, give them medications? No, this is a child that must be seen by the pediatrician. They need more information. It could be something severe because that kid has no backup. There is, something happens, 6 weeks old, they have no immune system. They have nothing to help themselves. They must be seen by a doctor. A multi. What should an infant be able to do at 9 months? I think probably the hardest part is all the developmental stages of a young child, especially the infants. What can they do? When can they do it? At what ages? Something that you're just going to have to look at. They can sit unsupported at 8 months, not support. Okay. They should be able to hold a rattle, pull themselves up, and roll completely over. The first expected fine motor developmental milestone for an infant begins with what? Remember F fingers. What's the first thing they do with their hands? That palmar grasp. What's the first one? And it's a reflex at first. Once they get that reflex, usually it's mommy's fingers at first. And then they get a little bit older and now they grab it. They can do voluntary grab that rattle, right? A 2-year-old has difficulty in activities, sensory sensitivity, and only speaks one-word responses. How would you assess that? Now, we can see that speaking only one word, they can't do activities, sensory, there's problems. Something's happening to this child. They're not where they should be. And there's all different sort of checklists and whatnot they can do. That sensory thing is telling you this could be autism. But just know that there are checklists and things. And we're not going to go into this until a couple more weeks, and we'll go into some of these things. But autism is not even diagnosed about age 2, and I'll go into why when we get there. A multi. Parents are concerned our 8-month-old's not developing like their older child. What's normal for 8 months? So we know by 6 months they're rolling completely over, and sitting unsupported is part of it. Now, first steps about a year, and blocks is like 10, 11 months. Multi. The mother of a child suspected of having Munchausen syndrome. What should be in the care plan? What do we need to do to protect our child here? Because remember, Munchausen syndrome, this mother is hurting her child to keep her sick. So your mothers must be supervised and you need to monitor everything. You don't need somebody in there all the time, only when that mother is there. What fine motor skill is expected of a 4-year-old child? Number fine is F fingers. They should be able to button their shirt by then. Their shoelaces later. Now, walking is gross motor. Again, the question, fine motor, gross motor. Be careful with those questions. A multi. What gross motor skills should a 4-year-old be able to do? Gross motor. They should be able to walk up the stairs and hop. Tying shoelaces is fine motor. Jumping rope is about a 6-year-old, okay? It's quite difficult to do. An RN's doing developmental screening on a 10-month-old should expect which fine motor skills from this infant? So we know it starts with fine motor, fingers, starts out with a reflex palmer, voluntary palmer, crude pincer. It should be then a fine pincer, then putting objects into a container and then block it too. So they should be able to grab it and use a pincer grasp there. So we're not putting them into a container yet. It's usually more like 11 months, closer to that year. Why do we do frequent developmental assessment? Why do we see what they can do? Are they rolling over? Are they sitting up? Are they using their fingers, their hands, their pincer? Why do we want to know these things? Because when you have children that are not rolling over and it's 9 months, there's a problem. We need to institute some sort of early intervention and find out why. So we do these assessments to make sure the child is where they need to be. And if not, give them the tools they need to catch up. And you know what the beauty of children is? They catch up really quickly if they're given the proper tools to get there. The natural physical sequence, developmental sequence that most children follow is what? What do they do first? Physical, gross motor, same thing. It starts with the head, right? And then they roll over, they crawl, they creep, they cruise, and they walk. Yes. A multi. Which would alert the nurse to hold the digoxin on infant she's caring for? Remember, questions like this is why you need to know what a vital sign is. What's right? What's wrong? What's too high? What's too low? And it's exactly like adults, except for the heart rate is different. A heart rate of 90 is way too low on an infant. Remember, 140 to 160. Digital levels too high, potassium's too low. Pulses don't make a difference on giving dig. Same thing as adults, it's just the pulse. In general, the infant should triple their birth weight at what month of age? And that's at 12 months. They double at 6 months, triple at 1 year. When an infant's toes spread when the soles of the feet are stroked, this is called. Take your finger like this and their toes spread out. What is that? Same thing for adults, same reflex. And that is called Babinski. Rooting is when you take the cheek and you rub it and they go for the nipple and try to eat. Startle or moral is when a noise comes and their hands and their feet come up. And we know what a grasp is already. How do you prevent otitis media in infants? Well, the first thing I can tell you is breastfeeding always helps. Smoke is the big thing with it, okay? So don't let smoke be around infants because it can cause ear infections. A multi. When entering an infant's room, the door slams and the infant jerks, starts to cry. What is that reflex called? This one. I gave you two names for it. And that's what we call moro or startle. It's the same thing. It's synonymous. It's the same word, and but different words to use the same thing. A 4-year-old is reluctant to take medication. What intervention should the nurse take? Probably the hardest thing for some parents. Some kids just don't want to take their medicine, right? So how would you do it? You're a nurse. So you got to get the medicine done. It's a very hard thing to do. And the thing is what we call a straightforward approach. What does that mean? Do you want a pill or do you want liquid? You want liquid, you want it in a syringe, you want it in a spoon. Find out what they want, give it to them, and let them take it. Usually, when you give them those choices, they're okay with it. Although I know it's difficult. Which intervention helps a hospitalized toddler feel a sense of control? What do toddlers like? It decreases stress on them. All about that routine, right? And the second thing is, encouraging the parents to stay. They always can't, but parents at the bedside is always that good thing. And also routine, routine, routine. A 3-month-old infant doesn't sleep through the night. What finding is most significant? What could cause a 3-month-old not sleeping all night long? They should be by now. Diaper rash. That's the biggest cause of infants being awake at night or waking up screaming. An RN assessing a 2.5-year-old toddler. What findings should you report to the provider? Which one of these is not right? And that's the head is bigger than the chest. Remember, by a year and a half, they should be equal or the chest should be bigger. Multi. What are risk factors for SIDS? Males more than females, smoke in the house, and if they were just sick. Breastfeeding decreases the chances of SIDS. What does the rooting reflex enable the infant to do? That rooting. And it's all about feeding. Yes. It's, oh, yeah, I want to eat. And their head moves that way. Multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? So, when you have diarrhea, stool, that's all the digestive enzymes, and it's extremely alkaline. So you're losing alkaline like crazy. What are you left with? And whenever you lose body fluids, you always worry about your electrolytes, right? So it's hypokalemia, and you're left with metabolic acidosis. I will be asking acid-based questions because one has to add 4 of them, 4 questions about it. Diarrhea, you lose alkaline. Vomiting, stomach acid, you lose acid. So when you lose it, the opposite is what you're left with. So we'll be going over that more as we go on. Normal language skills for a 3-year-old child. We know by 1 year it should be at least one word, right? So it's about 4 words in a sentence. Some do more, some do less, but should be about 4. An infant's NPO to their medical condition. What's important to remember? They still need their growth development. They still need something when they can't eat by mouth. They're not getting that satisfaction of anything oral. This is all about giving them a pacifier and let them soothe themselves with their pacifier. Good job. And last question. What should an infant do at 3 months? What's the first thing that they do? And it's all about their head. Very good. Let's see how we did today. Number 3 was Ennis. Good job, Ennis. Sarai, number 2. Number 1. Mariolis, yes, very good. 4. Jania and Jesus. Good job, guys. So these Cahoots are very important. Important for quizzes, they're important for exams, they're important also for your essay. There are a lot of those things that you're going to see come back at you. When you come back next week, you're going to have quiz number 2 at the beginning of class. Look at your Cahoots again. Look at the PowerPoint again. All your answers are going to be there. Okay? And remember, there is another discussion question. Remember the discussion questions. If you're less than a 20, please go look at the comments. I'm going to put something in there that's going to tell you why it wasn't what you wanted it to be. Okay? And I'm probably going to give you after this week, because I didn't do any lates or anything with this one. I'm going to give you more information. So always go back and look what I have to say. Okay? Also, week 8 is your pediatric assessment project. Start thinking about what pediatric assignment, assessment, project, diagnosis you want to do. Could it be something you had, your child had, your neighbor, your friend's kid? Give me something you want to do and let me approve on it. And as we go along, I'm going to tell you when is a good time to do the paper or to do the assessment part or do the teaching part. Okay? So just think about it. Anything, any questions, send me a message. I'll get back to you. It's a pleasure to teach you. And good night, guys.
Thank you.
My pleasure.
Hi, Professor. Thank